Good afternoon, everyone. I'm Robin Wilt, Brighton Town board member and 2020 candidate for Congress in New York's 25th Congressional District. I want to thank you all for joining us today for another COVID-19 community check-in and update. Now, these are updates where we highlight the issues facing our frontline and our most vulnerable community members to raise awareness and build action around moving forward through this pandemic together with no one left behind. Now, speaking of everyone in and no one out, today we are going to focus on healthcare in the age of COVID-19. A common refrain during our COVID-19 pandemic conversations has been that the virus didn't create the challenges that we're currently facing, but rather it exposed the deficiencies and the inequities within our current social systems that exacerbated vulnerabilities among certain communities. Now, this is particularly true when it comes to healthcare. The United States is the wealthiest nation in the history of the world, as Bernie Sanders likes to say. However, we're the only wealthy nation without a universal healthcare system. Currently, the US fails to insure 87 million of its people. And especially as the unemployment numbers soar to 36 million, our employer-based provision of healthcare has not only left more people unable to access treatment during the pandemic, but it has rendered our healthcare infrastructure ill-prepared to meet the challenges of the COVID-19 crisis. Now, the US, despite having the highest per capita healthcare spending, has fewer hospital beds per capita than any other wealthy nation. In recent years, there has been an epidemic of hospital closures in underserved rural communities and of major academic safety net hospitals like Hahnemann University Hospital in Philadelphia. These hospitals closed not because they're unneeded, but because they are unprofitable. In America, the hospital landscape is shaped by market forces, which means that profitability, not need, determines where hospitals are sited. At the same time, while overall hospital bed supply is relatively low, our ICU bed supply per capita is among the highest in the world. However, those beds aren't necessarily located where they need to be. Our large regional disparities in the distribution of ICU beds have rendered some areas with a surplus of beds, while others with need have too few. Again, this distribution far too often is driven by market logic, not healthcare logic. Finally, healthcare in America is uncoordinated and largely unregulated. Since the epidemic's onset, the New York Times noted that hospitals and city and state governments have waged bidding wars over crucial supplies of PPE and ventilators. The American way of paying for healthcare, our hospitals, or more accurately of late, our multi-hospital systems, is within silos with some rich and some poor, each fending for themselves, engaged in market competition. In the COVID-19 era, we witnessed states form their own impromptu cooperatives to try to mimic some sort of system. This atomized process is neither humane nor is it rational, leading to both unnecessary excess and shortfalls and to exorbitant overall health system spending, yet care that remains unaffordable and inaccessible for many. But in this grim landscape, there is opportunity. The majority of Americans, including myself, would like to replace this chaotic healthcare system with landscape, because we don't have a system, with expanded and improved Medicare for all, which would allow us to move past the market-driven status quo to remake this chaotic healthcare landscape into one that is universal and more equitable. To that end, today we are joined by Katie Robbins, Director of the Campaign for New York Health and Executive Director at Physicians for a National Health Program. Katie was also recently honored back in January as number 11 on City and State's New York's Health Power 100. Congratulations, Katie, on that.
Thank you. Actually, number 36, I just want to say. It was
36, okay. To me, you're like at the top, so. And we're also joined by Rohit Pali, MD candidate at the University of Rochester and local organizer with Campaign for New York Health. First of all, I want to welcome you both and thank you for joining us in conversation today. We've been so fortunate to host people who are really making a difference in these struggles for equity within our social systems. And so I'd like to give you each the opportunity to introduce yourselves in greater detail and tell us a little bit more about your community involvement. We'll start with you, Katie.
Sure. My name's Katie Robbins. I'm the director of the Campaign for New York Health, and I live in New York City with my family. I've been advocating for universal single-payer healthcare or improved Medicare for all for about 13 years now. And I'm very proud of the work we've done to build up a statewide campaign pushing for a universal publicly financed, high quality, guaranteed healthcare system here in New York State. And I have the pleasure of working with amazing activists all over the state, including the both of you who are here today.
Oh, great segue. Rohit, will you please introduce yourself?
Yeah, hi. So my name's Rohit. I'm a local organizer in Rochester. I'm a medical student. I've been working here almost for 4 years since we started really trying to ramp up organizing for the New York Health Act in Rochester. And I just would point out that we're pushing for a state level bill called the New York Health Act that would basically bring that improved Medicare for all system to the state of New York. And I'm really excited that we've been able to make a lot of progress on that locally. And we've done a number of things to that end, but we can get into it later. But it's been really great to get to talk to people and see how much support there is out there for a better way of doing things.
Thank you so much, Rohit. And you made a great distinction here. For those who don't know, and I'll go back to Katie here because you're familiar with both the federal and state level bills that are out there. For those who don't know, what is the New York Health Act and how does the New York Health Act compare to expanded and improved Medicare for all at the federal level, particularly the legislation put forward by Pramila Jayapal in HR 1384?
It's a great question. They're very similar in the sense that they're universal programs that would cover every resident, that's every resident regardless of age, job, income, immigration status, marital status, everyone is covered. In addition, the benefits are both mirror each other in the sense that they're designed to actually meet the health needs of the population. So while the New York Health Act covers just New York residents and workers in the state, and the national bill covers, of course, every resident in the country, the benefits are very similar. So you're talking about physician, hospitalization, mental health, vision, hearing. Imagine your eyes and your ears and your teeth are treated as part of your body and needing health care. And
radical, Katie.
Totally. In addition to that, they both bills at the state and national level now include long-term care and support services, which is a huge unmet need in our population in the state and nationally. People often have to spend down their income, impoverish themselves to be eligible for Medicaid, which is the only public program that covers long-term care for folks. So the bills offer a plan both at the state and national level they're virtually more generous than any existing public or private insurance plan. Everybody gets a card. You're able to go to your doctor, your hospital of choice. There's no narrow restricted networks. And most importantly, it's financed similarly to how they do in other universal healthcare systems around the world through public means. A progressive payroll tax in New York State is what funds most of it, and a tax on wealthy folks. There's a lot of wealth in New York State. We absolutely have the money to have a high quality healthcare system that covers everyone. And we can go into it a little more, both the state and the national level. There's huge savings in moving to such a system because you're getting rid of the profit seeking, bureaucratic, creating middlemen in terms of the private insurance companies. So it saves billions of dollars at the state and national level, money that can go back into the healthcare system to provide benefits, make sure we have adequate providers, and basically bring us into, the status of having a developed healthcare system like our peers around the world.
Katie, you make such great points about the fact that our out-of-pocket expenses will actually be reduced with implementing the type of system that you're advocating for on the state and federal level. So, and that there is enough money currently in the system to fund these changes. So, I think that's such an important point to make. Often you hear about, how are we going to pay for it? And it's actually less affordable to maintain the lack of a system that we have now than it is to transition to a Medicare for all or a system like the New York Health Act, a single payer system. So thank you so much for making that point. I want to move to Rohit a little bit, bring it back down to the local level. Rohit, what's it like to organize for the New York Health Act in a city like Rochester?
It's really a pleasure. You get to talk to lots of different people. And I think a lot of people, the vast majority of people I've talked to actually want everyone to have healthcare. And so, especially if you kind of help them reflect on their own experiences with the healthcare system, people tend to realize on their own that that what we have now isn't working, and especially isn't working for those that need it the most. And so, I think, yeah, it's really great to be able to talk to lots of different kinds of people and hear the experiences they've had with the healthcare system, which can be very tragic, and then help them realize their own voice in advocating for a better system for all of us.
Yeah, so much of the advocacy around getting a single payer system has involved people relating their personal stories. And that was definitely a poignant point in the healthcare online town hall that I participated in yesterday with the Campaign for New York Health. We just concluded a budget session at the state level where we saw devastating cuts to Medicaid incorporated to our fiscal plan. What is the status of organizing for the New York Health Act, Katie? Can you lend us some more insight?
Yeah, obviously it's a challenging landscape for moving legislation when the legislature is suspended. People know the governor has gathered a lot of power during this period. So most of the response to COVID has been through his executive actions. And unfortunately, the legislature hasn't met since they passed the budget in early April. But that said, the legislators are still working, and we work closely with our legislative champions in the Assembly and the Senate, Dick Gottfried and Gustavo Rivera. They're both the chairs of the Health Committee in their respective chambers, and they're very passionate about the New York Health Act and trying to figure out ways to put it on the agenda so that it's a central piece of the recovery to this devastating pandemic. I think many of us feel like, as you said, Robin, that the pandemic has revealed so many of the structural inequalities and vulnerabilities in the system before this hit. And unfortunately, this virus is making that so much worse. So coming out of this, we need a healthcare system that is designed to cover everyone. So you're not losing your insurance as you lose your job in the middle of a pandemic. Like, do I have to say this? Really? So legislative advocacy is such that the solution is on the table with the New York Health Act. We have a majority of the Assembly behind us. We almost have a majority of the Senate, and we need to build the kind of movement that puts enough pressure on the levers of power in Albany so that we get the governor to back this up. So the kind of work we're doing at the Campaign for New York Health is, like Rohit said, we work with real people, working with them, training them, telling our stories so that people don't feel like what they're experiencing when they can't get healthcare, they can't afford healthcare, even if they have insurance or not, that they're not alone and they're part of a movement that's working to change this.
That's great. That's great. Yeah. Again, and some of the stories are heartbreaking, but a lot of them really are inspirational. And I think it's such a compelling strategy to have people share their healthcare stories and demonstrate firsthand where our system is failing people and the opportunity that exists. Do you feel that the COVID-19 public health crisis has changed people's view on single payer? Is it more popular now? And I'll ask this of both Rohit and Katie, if you wouldn't mind.
Rohit, do you want to go first?
Sure. I have a hard time answering that because I feel like it's been hard to talk to a broader section of people while social distancing. But I can certainly say that the commitment has grown among the people I know that this is the way we need to go. And especially I feel a lot of the activists feel like it's like a now more than ever. We need this thing we've always believed in.
Absolutely. Absolutely. I mean, it's true. Millions of people have lost their health insurance in the middle of this pandemic nationally. And I believe in New York State, we're at about 1.5 million people have filed unemployment. A number of them are going to lose their health insurance or have lost their health insurance. You know, Medicaid is going to take up a lot of the people who lost insurance, but not everyone. We have such a fragmented system, you know. So at a time when people need healthcare most, they're losing their insurance, and that's so devastating. I think nationally there's polls that show an uptick in support for improved Medicare for all. In addition, you know, we've done a ton of virtual town halls, you know, so we are going out and having this dialogue with organizations and with elected officials across the state. And there's been a real change in the kind of questions that are asked about this bill. You know, before the pandemic, there maybe was like a little more concern over like, well, how exactly does that change, you know, my plan to this new plan? And now it's a little more like, when can we get this done? It's clearly so necessary. So the technical questions are a little bit less important to people.
Right.
And I think that's very telling.
Yeah, well, we saw, like I said, 36 million people have applied for unemployment, and of those, 16.5 million have lost their health care. And with the HEROES Act, the most recent pandemic aid bill that was passed, we did not see, what we saw was not the type of healthcare expansion that we really need. It was really an expansion of COBRA, which is some of the most expensively delivered healthcare in the world, and as opposed to a system that like Medicare for all. And so we really need to keep fighting because people really are hurting, and our response to the pandemic is hindered by the lack of access to care. We don't want to put any barriers in the way of people seeing a doctor when they are potentially sick with this virus, because it can be so severe. So thank you so much for everything you're doing. So Rohit, you mentioned you've been organizing on the local level here in Rochester for about 4 years. And what do your peers at medical school think about your extracurricular activities with New York Health?
I mean, like all groups, it varies, but I think a solid majority of them, probably I would say the vast majority, are very supportive. And even, you know, I've run into maybe 3 dissenters in my entire time with the school.
Okay.
And even the people that, even among those, they're more likely to say, oh, I'm not sure, than like, oh, this is a bad idea. And so I think there's a lot of support among medical students. And I think that tracks with there being a lot of support among young people in general, for Medicare for All and for all sorts of programs that improve our society.
Yeah, I think you make a really important point there, Rohit, because the vast majority of Americans do support a universal single payer healthcare system like Medicare for All. And so it's really, you're in the minority if you don't support implementing a system like this. And I think a lot of people don't realize the level of support that this type of system had even prior to the pandemic. Even though we've seen a shift in focus and people paying more attention during the pandemic, it was actually widely popular prior to that. Katie, can you tell us some of the constituencies that are most vocal supporters for the New York Health Act? Are they healthcare workers, or people having trouble accessing healthcare, or small business owners? Who is out there supporting the Campaign for New York Health?
Yeah, we have hundreds of organizations and businesses that have endorsed the New York Health Act as legislation and who work with us at the campaign. So some of our biggest supporters, I mean, I can't start without mentioning the nurses. The New York State Nurses Association, 42,000 members across the state who are now on the front lines of delivering care. And they've supported the New York Health Act for years, but now going through what they're going through, where they're seeing their patients suffering, they're seeing the most vulnerable folks in their communities being hit worse than others by the pandemic. And in addition, they themselves are struggling to get the proper protective equipment at their hospitals so that they can safely care for patients. So it's just like a lot of intersecting, you know, the issues with lack of safe staffing and PPE with the inequities that are experienced by their patients is like a perfect storm for explaining to, you know, their members and getting their members active in advocating for the New York Health Act. So the nurses are definitely at the front lines of this fight. We also have strong support from physicians and medical students. There's a group, Physicians for a National Health Program, that has been around for years advocating for this. And a majority of physicians are polled in support of a single payer program. And, you know, you were seeing, just like Rohit said, the younger physicians and medical students are like ready for this. Doctors and nurses want to, they go into this work in order to provide care, you know, to help people for the most part. And when they are spending so much of their time, some studies have estimated up to 48% of their time, I mean, hours and hours every week, dealing with the paperwork and bureaucracy of the private insurance industry. So a single payer system would greatly reduce the administrative side of things and let them focus on what they went to school for, all those years of school for, to actually provide care to their patients. But like I said, we have a very broad coalition. So, you know, on the big campaign rally yesterday, you know, featured obviously public officials and healthcare workers, but business owners, teachers, people from all different walks of life are excited about the possibility of winning an improved healthcare system. I could mention a little bit about who's not for the New York Health Act, which might be very telling. You know, if you are an insurance company CEO, if you're working for the largest corporations in New York, chances are you're a member of our opposing coalition, the realities of single payer. And I will say, when I'm having a bad day, sometimes I just go over to their Twitter feed and I read the comments. And the comments, you know, they have a ton of money. The insurance industry is making hand over fist off this broken system that's leaving people uninsured, inadequately insured. They're very unpopular. And it's not hard to understand why, when they take your premium dollars and put them into BS ads opposing a single payer healthcare system. Well, let me tell you, the folks on Twitter are very smart, and their comments are almost always pro single payer. So it's like all the money that they're putting into this ad fighting us is in some ways backfiring. And I just encourage people to check them out on Twitter and be, you know, feel the encouragement of all the people clapping back at them for their misleading information.
So people get on Twitter and ratio those health insurance companies that are bad actors. Please do it now. Do it today. It's kind of interesting to see those ads and how ham-handed they are, really how out of touch they are with their impact on the average American, and how much the average American is suffering for lack of access to care, especially in these uncertain times with this pandemic. So yeah, that leads me into kind of our wrap-up question. We always like to leave here with action items. How can people help to make single payer a reality in New York State and federally?
Well, I'll jump in and then I'd love to hear Rohit's comments as well on the local level in Rochester. Of course, I'm going to plug our organization's website, which has a ton of information and upcoming events, including the trainings, storytelling trainings, and other town halls. So go to nyhcampaign.org. There's a big red button on the homepage that says contact your senator. We need you to click that, and it connects you to a tool where you can email and tweet at your elected officials and Cuomo and send the message that we need the New York Health Act to be central to the recovery from this pandemic. And on the national level, the nurses are leading a campaign for Medicare for All. You can go to Medicare4all.org and sign up to find out about their work on the national level. And those are, I think, the two best ways for people to plug into what's happening in advocacy right now.
Great, thank you so much. And Rohit, can you add anything?
Yeah, I would add that at the local level right now, we have, well, going to the nyhcampaign.org link and signing up will automatically get you some of our emails. But we also are doing somewhat regular storytelling trainings, and we have our, normally it's a potluck, but we have our monthly organizing meeting on the last Wednesday of every month. So if anyone wants to get involved and help make decisions about what we're going to do to build towards the New York Health Act in Rochester, I suggest coming to one of those. Yeah, it's the last Wednesday of every month, or keep your eyes out for storytelling training.
Great. Thank you so much today for being here today. And I do want to share just the Sanders bill that I mentioned earlier, the Healthcare Emergency Guarantee Act, which Senator Sanders first announced last month in conjunction with Representative Pramila Jayapal. And it is currently co-sponsored by Senator Kirsten Gillibrand and Ed Markey of Massachusetts and Elizabeth Warren of Massachusetts, also Cory Booker of New Jersey and Jeff Merkley of Oregon. Oh, and Kamala Harris out in California. And I think that it's sponsored by so many former presidential candidates because they actually have been around in our communities and seen the fervor there is for some kind of action with regard to universal health care. Now, this bill is so important because it would immediately halt all medical debt collection, limit prescription drug prices, and prohibit private insurance companies from decreasing coverage. And as our unemployment claims, as I said, have topped 36 million, and an estimated 16.5 million people have lost their employer-based health insurance, it's critical that we make this push right now. So contact your representatives, including Joe Morelli, my opponent, who has not supported the Healthcare Emergency Guarantee Act, and make sure that they hear from you and your support for this bill. Again, I want to thank our guests for joining us today. Katie and Rohit, you've been so instrumental in raising awareness about this issue and making sure that there's the advocacy there to create a better system, a more equitable healthcare system. And I can't thank you enough.
Thank you. Good luck with your race, Robin. It was great to be here.
Yes, thanks so much, Robin.
Thank you. Have a great day, guys. Stay safe.